Coming up, we'll be on location at Millennium Medical in Chevy Chase, Maryland, discussing the latest advances in aesthetic treatments, health, and wellness, and how they can improve your appearance, help you look younger, more refreshed, and improve your overall health and wellness with one of this area's top doctors and cosmetic surgeons, Dr. Hadi Michael Rassael. Welcome, Dr. Rassael, to the Top Doctors Interviews program.
Good morning, and thank you for having us.
We have a lot to talk about today, but before we get into that, I wanted to touch on your background, Dr. Rassael. You've been practicing in this area, the DMV region, for over 20 years. Correct. You've got wonderful experience. You've helped so many patients improve their appearance, their health, their wellness. You're recognized as a top doctor and cosmetic surgeon throughout the DMV region. And I wanted to begin by talking about your wonderful practice located here in Chevy Chase, Maryland, Millennium Medical. Can you please tell us about your vision?
Well, Millennium Medical has been here for almost 20 years. And my vision when I started this practice was to have a comprehensive aesthetic medicine, healthcare, and detailed patient care. I think it's very important to recognize that we are not a cookie-cutter system. And our vision was always to listen to the patient and deliver what they need. We pride ourselves on having state-of-the-art technology, the latest in all the developments to deliver aesthetic and beauty to the patient, as well as give patients a better, healthier life through our wellness program. We truly envisioned having that from day one, and we continue to do so, not just by me, but every member of my staff. And I think that's what makes us second to none.
That's a wonderful approach, Dr. Rassael. You're really patient-centric. You take so much time with each patient. We hear some of your patient testimonials and stories about how you really care for them. You really understand what their goals are and help them not only achieve them, but to exceed those expectations as well. You offer many aesthetic and cosmetic procedures as well as health and wellness. I wanted to begin, Dr. Rassael, by talking about hair loss. It's a problem that affects so many people. There's different treatment options over the years that didn't work or do work. You're an expert at this, so I wanted to ask you, what do you offer here that are some of the most effective treatment options for hair restoration?
I want to begin with pointing out that hair loss is a problem for both men and women. And we have helped both in the past years that we've been here. I've been doing hair transplants and hair loss treatments for 25 years. And I probably trained with some of the best surgeons in the world. And I continue to keep up with the latest developments, technologies, and medical management of hair loss. We generally, at this time, do effective hair loss treatment with hair transplant. And we use a method called FUE, or follicular unit extraction, which is minimally invasive. It gives great results and very little downtime. We can use other methods, but currently FUE is probably the best and most effective way to go. The one thing I'm proud of is that we've been with the same team, and hair transplantation is a team effort. We've been with the same team for the past almost 2 decades. And that's what makes our results and our treatment plan shine through. It is truly something that our patients are very comfortable with, and they remember that because there are times where patients come back for second treatments and they see the same team, and that is truly an effective way to make sure the patient is comfortable. They realize they're getting the best treatment possible.
Yeah, you definitely have wonderful experience. You've been doing this for many years. You're renowned for your results. I mean, people really rave about the results. What is this FUE treatment and how's it performed?
Well, FUE involves a machine that extracts single follicular units from a donor site. That donor site generally comes from the back of the head. However, you can use other body parts, and we have done so in the past, to achieve some donor hairs. But for most part, I would say 95% of the times, the hair donor comes from the back of the head, and those follicular units are then harvested, they're prepared, and then through predetermined sites that I make for the recipient area, let it be on the scalp, let it be on the face, or other parts of the body. We have done eyebrows, eyelashes, and so on. We place these individual follicles into those recipient sites, and fortunately the body then takes that hair through a process and it turns onto your own natural hair. The one thing that my patients always rave about is that when they do the treatment, nobody knows they've had a hair transplant. And that natural result is what makes it great.
That's wonderful, because we've seen hair transplants over the years where they look like that dull hair with
Correct.
the plugs and all that.
Yes.
And achieving that natural result is so important because no one wants to look like they had it done.
Correct.
And you're consistently providing those great results for your patients. How long does this procedure typically take?
That's variable. It depends on the number of hairs needed, the area this transplant is being performed on. Generally, it takes anywhere from 4 to 8 hours. I tell my patients all to expect to be here all day because the end result is the importance, and we dedicate an entire day for our patients when we have hair transplant days. So therefore, if it takes 4 hours, 6 hours, 8 hours, or even beyond, our main goal is to give the patient the best result possible.
And is there any downtime from this procedure where people have to miss work or?
Yeah, for most hair transplant patients, I do tell them they need to take roughly about 3 to 7 days off, depending on the kind of work they do. There's a first few days that you have to rest, obviously. But as far as being able to do simple chores, you can probably do that within a couple of days. So the downtime, especially with the FEU technique, is very little.
Is the FEU procedure for everyone, or who would you say is a good candidate?
But first and foremost, we have to do a good history and physical on our patients. Make sure they don't have any medical issues that prevents them from getting the hair transplant done. That is key. But secondarily, also understand the patient's expectations. Great candidates are the ones that have either mild to moderate hair loss and have fantastic donor sites. Those are the cases that are done without any issues. As I mentioned, you can harvest, grafts from or follicular units from other parts of the body and the face to use on the scalp and vice versa. So the patients that are, again, ideal are those, as I said, that have moderate loss with good donor sites and the ones that are in good health. That's also important.
And when can patients begin seeing results? Is it something that happens right when they leave and after the healing has happened, or is it several months?
Yeah. When the follicular units are placed, they are small, short hairs that are put in. Those hairs, not the follicular units, do fall out within about a month. At that point, the patient has to wait about 3 to 4 months to see the beginning of growth from that point on. And for a full growth to occur, for them to see the final result, it's usually about 8 to 10 months for the final effect.
Oh, okay, that's not bad at all. So when those results are in and your hair is restored, and how long does that last? Is it something that's permanent, or is it like your hair, because previously you lost the hair, but now
Right.
you have follicular transplantation? How does that work?
Yeah, hair loss for most patients, especially in men, is due to a process in the body that is hormone related. In men, testosterone is converted to dihydrotestosterone called DHT. And in most men, as they have the male pattern baldness, the hormone DHT is responsible for that loss. Fortunately, the hair in the back of the head, in over 99% of the cases, don't respond to DHT. And therefore, the hair that is harvested from the donor site and placed into the front of the head is permanent.
And Dr. Rassael, is this all done in one session, or how many sessions are typically necessary?
That's a good question because patients all want that final result. Although one session can give you very good results and significant improvements, there are those cases that you need additional treatments to fill in gaps or additional areas. As you can imagine, as the hair that we transplanted grows, patients lose their own natural hair through time. So they would need additional surgeries to fill those in. Also, I'm a believer that doing over excessive transplantation can be a negative thing and give you suboptimal results. Hair follicles require blood supply to survive and grow. So in a small area, if you implant too many follicular units, you actually are hurting them, not helping them. There's a lot of practices, unfortunately, due to the matter of charge and cost, they promise a great deal of number because that's how hair transplantation is done. But unfortunately, over-implantation can create problems.
And that's what I love about you and your approach, Dr. Rassael. You really care about the patient and you want the best results for the patient. Not how many hairs transplantations I can do, but to make sure that it's natural and they get the best results. And that's truly putting the patient first.
First, always.
Yes. You offer hormone replacement therapy here at your
Right.
practice as well. That's something that we hear about. So I'm excited to talk about that today. Can you tell us what it is and how it works?
Our goal is to give patients a better quality of life, better aesthetic results, feeling great about themselves, and improving their self-confidence. Bioidentical hormone replacement is something that we perform at this practice, along with other wellness treatments. Bioidentical hormone replacement, also known as BHRT, is something that uses hormones that are identical chemically to what your body naturally makes and replenishes that back to your body. Of course, that requires a great deal of medical intake, detailed history and physical, and a very comprehensive blood work to determine what every patient needs. And as you mentioned, that's for men and women.
And as we age, we lose hormones. We don't produce as many.
Correct.
What kind of problems or symptoms can we look for to know that we're a candidate for this?
Yeah. Most patients develop reduced energy, desire, motivation, inability to work out as well as they should, a reduced recovery from exercise and activities, and even on the mental sense, reduced cognitive skills, sleep disorder, at times anxiety and depression, not to mention the sexual dysfunctions that patients suffer from, decreased libido, erectile dysfunction, vaginal dryness. And subsequent to these, patients also develop other issues that go along with all the above mentioned problems. And these are all something that you need to look for in people that are developing hormone depletion in their body.
And these are very important areas of our life, of our health, our happiness.
Of course.
The fact that we need energy, to have high energy, to enjoy life, to have activities, to be motivated, to be driven. Sexual health goes without saying, how important that is as well.
Of course.
So this really can affect so many aspects of our life.
Absolutely. In regards to, in men, of course, the mainstay is testosterone. And in women, it's both testosterone and estrogen. Again, blood work is key to figuring out exactly what the dose is that the patient needs. But listening to the patient, figuring out what their needs are, is caveat for determining their treatment plan.
And I know every patient is different, but is there a typical or common age that we can start experiencing this hormone loss?
Men generally begin developing what they call andropause in their 40s. Women about the same or slightly later, where they start developing menopause. However, it's not unusual to find men in their 20s or even 30s that have developed hormone dysfunction. And in women, the same. So, but the typical age is men in their 40s begin having problems, and women in their late 40s or early 50s.
Say a patient begins the hormone replacement therapy, Dr. Rassael, when can they start seeing the results?
Okay. For most part at this practice, we perform what they call pellet hormone replacement therapy treatment, which is bioidentical hormone replacement treatment. And within about 2 to 3 weeks of doing the treatment, patients begin to feel improvement. Of course, it varies from patient to patient. Some patients a little earlier, some patients a little later. With regards to injections with testosterone in men, or creams, both testosterone and estrogen in men and women, that can vary from patient to patient as well. But generally, that's a little of a quicker onset of improvement.
And how long does the hormone treatment have to continue? Is it something that once it's completed, we don't have to have it,
Yeah.
or do we need to continue it for our lives?
Yeah, that's a question that a lot of patients ask. And if you do want to continue feeling great and having the benefits, it's a lifelong commitment. Unfortunately, when you stop the treatment, then your levels fall back to where you started from. And if you want to maintain that so-called internal youth, feeling more energy, better state of mind, better cognitive function, better sexual function, then you have to continue with the hormone treatment.
And that makes sense because life goes on and we continue to age, right?
Correct.
So we're going to continue to lose the hormones naturally.
Correct.
So as we age, we have to continue the process or the treatment. So it definitely makes sense.
An interesting thing that patients at times tell me is that they should have done this 5 years ago.
That sounds like a great treatment that can definitely improve our health, wellness, and our lives. You also perform cosmetic surgery, cosmetic treatments, Dr. Rassael. Can you
Correct.
tell us some of the most effective treatments that you offer here?
Sure. We are truly a comprehensive aesthetic medicine and cosmetic surgery practice. And we try to give our patients what they desire. I look at cosmetic surgery as 2 areas: body surgery and facial surgery. In facial surgery, we perform procedures such as facelifts, neck lifts, upper and lower eyelids known as blepharoplasty, brow lift, and implants, facial implants. Those are the mainstay of facial cosmetic surgery. With regard to the body surgeries, or body contouring surgeries, there is, of course, liposuction, breast surgeries, which covers breast augmentation, breast lift and augmentation, and breast reduction. Abdominal surgery covers liposuction, abdominoplasty, also known as tummy tucks, and other body lifting procedures such as arm lift called brachiopexy or thigh lifts.
You do a combination of different types of procedures, and sometimes a patient may require more than one as like a collective or a complementary treatment.
Correct.
Can you tell us how some of these are performed?
As far as liposuction, for example, it's performed through small incisions through the area that needs to be liposuctioned. A tumescent solution is introduced to the area to loosen the fat, and then through what they call liposuction cannulas, the fat is suctioned out, and we end up breaking up the fat if need be, and some of the banding to create a more smooth contour to the area. There's other kinds of liposuction called laser liposuction, which helps with skin tightening. That's more for small areas of liposuction. There's ultrasonic liposuction that we can perform. But along with that, there's other body contouring treatments that we do. A lot of times when we do abdominoplasties or tummy tucks, it's incorporated with a liposuction where the abdominal excess skin is removed. The loose skin is then sewed back. But along with that, the patients that have poor muscle tone, their abdominal muscle is tightened up. It's called plication. So that in combination with liposuction is something that we generally do a lot of at this practice, combination of liposuction and abdominoplasty. With regards to other body surgeries, I mentioned the breast surgeries. Breast augmentation entails putting an implant in. With regards to the facial surgeries, facelift, neck lift, and upper lower blepharoplasty, they're performed here under local anesthesia with the same great results as with or without anesthesia and with less downtime.
So you mentioned, Dr. Rassael, that you do quite a few of the procedures here at your practice. Do you also do some at the hospital? How does that work?
Yeah. In cases that are more extensive, more extensive liposuctions, abdominoplasties, most of the breast surgeries, they're done at certified surgery centers where general anesthesia is administered for the patient's comfort, even on more extensive facial surgery cases where multiple procedures are done at the same time, such as brow lift, facelift, and lower lid surgery. We do those as well at these certified surgery centers with general anesthesia.
And you have a state-of-the-art practice here
Yes.
at Millennium Medical with some of the latest and greatest technology, lasers, and we talk to the patients. They get truly comprehensive treatments. I mean,
Right.
whether you're looking for facial rejuvenation or you're looking for improving your health, your energy, with the hormone replacement therapy, hair restoration. I mean, I love that you can come to one location and you can have pretty much everything done, whether it's about your appearance or your health and your wellness with the energy. Can you tell us about the patient process, Dr. Rassael? When a patient first contacts you, how do you evaluate what they may need or what can they expect?
Patients generally call in, obviously, and they talk to our staff. And the staff does the initial intake, asks a lot of appropriate questions to try to see what the patient's needs are, what their expectations are. But they're always encouraged to come in for consultation with me. We try to find out exactly what the patient's needs are once we are sitting with them at the practice. It is difficult to sometimes assess what the patient's problems are and what their needs are and what we can deliver to them just on the phone. So we encourage everybody to come in for a consultation, sit down with them, take our time, and truly see if their needs can be met and if something we can help them with.
It's a true partnership, right?
Correct.
Patient education is very important, and that's what I, again, also really appreciate what you do at your practice is you take the time with each patient to really understand their needs, their goals, and so you can put the optimal plan together to give them the best results.
Correct.
Well, Dr. Rassael, that was very informative. I want to thank you so much for joining us, being a guest today on our
Thank you.
program.
Thank you for having me with your team.